Hey guys, welcome back to my channel. I'm Cassie, and today I'm excited because in this video I'm going to be taking you behind the scenes for a day in the life of a dental hygienist. So right at the start of the day, I like to go ahead and turn on all of the equipment, make sure that everything's working, make sure that everything is on, make sure that I have all of the things in my room stocked that I'm going to need. So here I'm just kind of going over what it is that we keep on the tray. And so you're going to have your basic kit that has some instruments in there. I like to give patients glasses to protect their eyes. I've got some prophy paste, some gauze, some floss, and a patient bib. And so this is just a basic setup of things that you might need. So I don't know about you, but I know I love me a good goodie bag. So one of the things that I like to do at the start of the day is make sure to fill up this drawer or whichever drawer I'm at with items that we like to give away in goodie bags. And so I make sure that it's stocked up with different options, catering to people who have bleeding gums. If you need a tongue scraper, we got those. If you have sensitive teeth, we make sure we have something for that. So I like to just stock it up at the beginning of the day, make sure that it's all set to go. That way I'm not scrambling at the end of the appointment looking for whatever it is that this person might need. And I find that doing this at the start of the day makes everything go by so much smoother. So something you'll notice is that I love to be proactive, and so one of the things I like to do is make a bunch of tray setups at the start of the day. That way, as the day is going on, if I happen to get caught up, if I happen to be behind, I already have tray set up, ready to go. That way I can clean my room and keep it pushing. So being that for certain patients they may require more things, I like to keep these tray setups super simple. So inside we'll have a patient bib, floss, gauze, prophy paste, prophy angle, and a saliva ejector. In certain cases, for example, if we were doing an SRP, to the tray I would grab what is already there. I would remove the prophy paste and the prophy angle, and to the tray I'd add anesthesia, I'd add more gauze, I'd add irrigation, and I'd make sure that I have all of the scalers that I would need to do that procedure. So depending on what it is that I need to do, I like to just have it already set up and ready to go. That way when I'm ready to go, so is everything else. So if you aren't familiar with this cool little gadget here, it is a instrument sharpener called the Sidekick, made by Hugh Freedy, and it is a battery operated instrument sharpener which makes it easier for you to get your sharpening done. And so instead of using the typical stone which you have to wet and move back and forth, this one is battery operated. You turn it on and it works. You sharpen your instruments and it's super simple. And so here I am just demoing it for you guys. So I thought that I would run through a typical appointment with you guys for a new patient. So this new patient also works alongside us and was kind enough to allow me to record. And so as you can see right now, I am getting some topical and putting it onto her gums. But before we get to that step, as she came in, she filled out a health history form. We reviewed all of the things that she has had done in the past, any surgeries, any medications she's taking, and things of that nature. We took a full set of x-rays. The doctor reviewed and did an exam. We also probed her entire mouth, and for this patient, what she needs is called a prophy or prophylaxis, which is a basic cleaning. So you'll see that I'm going back and forth between using hand scalers and also using the Cavitron. Make sure that you're flossing all of your patients, make sure that you polish and rinse everything well, and make sure that you review what it is that they need to work on. Educate them, let them know what it is that they can improve on, what they should be doing, what they should be using, and how. So at the end of the appointment, you got to make sure to break down your room. And so I like to get all of the instruments out of the way first, usually, because those will be the things that have blood and anything like that on it. And so I like to clear those out right away, and then I like to go in and wipe everything down. Just make sure to be very careful and very thorough when you are cleaning the room after having somebody in there, because you want to make sure that you're not cross-contaminating anything, make sure that you're not spreading anything. And so it's very important to be diligent when you are breaking down your room and clearing it out for the next person. So many of the chemicals that we use to disinfect and sanitize are pretty strong, so always make sure that you have your gloves on and that you have your mask on to cover your nose and mouth. It's just something that's important to remember to do, because I know sometimes we'll want to grab a wipe with no gloves on. Don't make a habit of doing that because it's not good for your skin. So just be careful as you are cleaning and disinfecting. Be thorough, take your time, and make sure to double check, because nobody's perfect. A lot of things in this field are very repetitive, and I find that for me, it's easy to stay on track. It's easy to keep it going and kind of stay on course when things are repetitive in this way. I know a lot of people find it to be redundant, but like in a negative way, like they can't stand doing the same things over and over. But honestly, dental hygiene is one of those things that if you really take your time and you get a good routine down packed, it will be so smooth and so easy for you to go about your day and to complete your tasks and to make everything just smooth for you at work. So I encourage you to get a routine going, take your time, don't overwhelm yourself, give yourself some grace, and try to have fun at work. I know it's hard, but try to have fun, engage with your patients, do things differently, switch things up until you find what works for you. So you can see me here just packaging up some instruments, getting them ready to go into the sterilizer. This is something that we typically have to do. It's pretty simple and straightforward. Out of one, into the next. So depending on where you work, you might have to write your notes down in a paper chart or jot them down in the computer. Here I am writing in a paper chart, but I'm writing down my notes. And something I like to do when I'm somewhere where there are paper charts is to have a sticky note for new patients to jot down notes about things that are going on as the appointment progresses. That way, when I get to the point where I write my note, I have everything that I need to know right there, and I can make sure that I have all of the important information inside of that note. Thank you guys so much for joining me on a day in the life of a dental hygienist. I really hope you enjoyed. Please leave your comments down below, like this video, share it with somebody who you know would enjoy, subscribe to my channel, and stay tuned for more. Bye.